Good afternoon, Leeward University professors and student body. My name is Martin Biefer, and this is my practicum presentation for Health 698, summer 2017. I did my practicum in South Africa and on the continent of Africa, and my topic is preventing HIV/AIDS in the next generation of South Africans. On the next slide is my introduction. South Africa is found in the southernmost tip of the continent of Africa. It has a very diverse population, about 51 million persons. 79.2% are Black African, 8.9% are white European, another 8.9% are people of color, about 2.5% are Asians and Indians, and another 0.5% are people of other racial groups according to the 2011 census. The country of South Africa has the highest HIV rate. About 5.5 million persons are infected, and the highest rate of infection is found in the province of KwaZulu-Natal, where I did my practicum. KwaZulu-Natal also has the second largest population in South Africa. My practicum was conducted in two villages, the village of Kula and Ezwanisha, and the population in the two villages is about 23,000, and it is believed that 13,500 persons are infected with HIV virus. 48% of pregnant women in this area are HIV positive, and it is believed that 52% of children are born HIV positive. My next slide, the purpose of my practicum. The purpose of my practicum was to create HIV awareness and conduct HIV/AIDS educational intervention classes in 2 primary schools. And from lesson 1 to lesson 2, and then the impact exam was given to the students to determine their knowledge of HIV/AIDS. I also carried out home-based care where I went from house to house empowering people about their health, listening to their problem, their medical problem, and sometimes giving them over-the-counter medicine like paracetamol. And if they complain of diarrhea for a couple of days, we gave them Imodium to help treat their diarrhea. I also assisted in the rural clinic. This rural clinic is being run by only nurses. A doctor comes once a month, and it is understaffed. So what I did was that I helped them to take the blood pressure measurement of patients and weigh those patients, and also take temperature of children, and then redirected the patients to the right room for further treatment. The next slide is the mentor. My main duty was to conduct the HIV educational class, and the mentor I used was a randomized study where the student will be randomly selected by the classroom teacher to participate in the HIV intervention classes. The HIV intervention class involved 34 students, ages 11 to 13, from 6 and 7 grades, from 6 to 7 grade. The class lasted for 10 days. We started with lesson 1 to lesson 8, and day 9 was a review, and day 10, the impact exam was being administered. The HIV lesson 1 included what HIV is and what sex is, and we used 2 puppet dolls to demonstrate to the children what sex is. And we also given the statistics on HIV for the world, for South Africa, and for the region in which they live. And lesson 2 was HIV transmission and the 4 fluids in which HIV is transmitted. We told them that HIV can be transmitted through 4 fluids: breast milk, semen, blood, and vaginal fluid. And the lesson 3 was the life cycle of HIV/AIDS and how it affects the human body, how HIV enters the body and destroys the CD4 cells and weaken your immune system, and then you're able to fight diseases. Lesson 4, HIV is opportunistic infections. We told them that TB, pneumonia, shingles, and fungal infection were the opportunistic infection associated with HIV within that region. And lesson 5 was HIV prevention, testing, and treatment. Students were told that to get tested is free. You can go to the nearby clinic and get tested without paying anything, and condoms are available at the clinic. You can also get condom. And when you're HIV sick, HIV positive, you can take your ARVs and you can get treatment. But the HIV medication will not cure you; it will only help you to live longer, as far as 75 years. And we also demonstrate the proper use of condom using a wooden penis. We have an HIV condom use checklist, and we demonstrated to the students, and the student then follow what we did, and they put on the condom on a wooden penis. That was that was a good time to be in the class. All the students were laughing. And lesson 6 were ARVs, the medication used to treat HIV, and they how to live positively with the disease. The students were told that if you are HIV positive, you have to do a couple of things to live healthy. You have to take your ARV, the medication for HIV. You have to take it every day. And you have to eat healthy. You have to exercise. You have to avoid alcohol. You have to get plenty of rest. And also that the ARV will not cure AIDS, but it can make you live longer, as I said previously. Lesson 7 was the stigma and discrimination associated with HIV/AIDS. During this time, we had a drama. Students were about 4 students were playing outside the class that assuming that they were HIV positive, while the rest of the students huddled together in the class and stopping the other students from joining them. So we also told them that that's a form of discrimination, discriminating against people with HIV. And when somebody is HIV positive, you cannot know they are HIV positive until they get tested before you can know. So you cannot discriminate against anybody assuming that they have HIV/AIDS. And at the end of the lessons, we had a review, and after the review, on the next day we had an evaluation exam. On the next slide is the accomplishment. The students demonstrated good knowledge of HIV/AIDS. Their average was 84.8%, although no baseline knowledge of HIV was mentioned. Out of 34 students, 27 students passed the exam. 4 students had a perfect score of 100, and the lowest score 36.6%. And those who passed the exam were certificated at the end of the program. On the next slide is the continuation of accomplishment. For the home-based care, the people always appreciate our presence in their life, for the fact that we came to them to help them with their health needs. They always appreciated us. We dressed their wounds, we gave them all the counter medicine if needed, and we empower them about their health through home-based care. In the clinic, the clinic staff and nurses, they appreciate our presence, and they always take our advice, and they always welcome us back. And African Impact Project, the group I work with, they are being appreciated by the town chief. Our boss was called, and they appreciated the effort that we made in that region. My recommendation is that the number of HIV/AIDS awareness class and intervention program will be increased to primary school children, since these kids are at risk. They are the next generation of South African. The program should be tailored to them to reduce the burden of the disease. Parents should be advised about HIV/AIDS. They should advise their children about HIV/AIDS and the danger it poses to their children's health. And the baseline knowledge of students must be measured in a pre-test before the intervention measures can take place, so that we can know the children baseline HIV knowledge. Secondly, the student should be tested for HIV at the beginning of the intervention through parental consent. I know this is a difficult thing to do, and then we can follow them into the future or into high school to see if the HIV intervention in primary school stick with them, and see who became infected and who did not get infected after reaching 12 years. Like that, we can measure the long-term impact of the program. The next slide is HIV graduation program, educational graduation program. And the next slide is a bonus slide with pictures of my practicum in home-based care at the clinic with another volunteer from Australia, and nutrition supplement on home-based care. And the other one is a home-based care where I'm taking the pressure off the patient right there. Thank you, and this is my practicum presentation. Thanks, Dr. Armour.